Thank you so much, Jenny. It's 7:31 right now. Uterine fibroids, endometriosis, or cervical cancer. Those are just some of the reasons why women of all ages are forced into surgery for hysterectomy, an operation to remove a woman's uterus. But what is a hysterectomy, and why do so many women keep that surgery a secret? Joining us right now to answer some of those questions is my doctor, a man that knows a lot about what's going on here. Is Dr. Kenneth Finkelstein, OBGYN, specializes in non-invasive surgeries, operations like this. Thank you so much for joining us.
Thank you so much for having me.
So, did I dare just say hysterectomy, and that in just real soon I'm going to be having one?
Well, you did, and I think that a hysterectomy is one of the things that are kind of misunderstood, I think, by a lot of women. When women come to me with problems with bleeding, with pain, from their periods, maybe with fibroids, which I think we'll talk about, I think there's a misconception of exactly what is a hysterectomy, what does it entail, what does it do to your body. That is definitely a for sure thing, and I do a lot of counseling talking about exactly what a hysterectomy is. And
you said you do quite a few of them every single year. I mean, once you go into the doctor's office, you realize you're having some problems, you're having some discomfort, and you have that open and frank conversation, because it's hard for a lot of women to have that conversation.
Oh, absolutely. I mean, my particular practice is more of a surgical gynecologic practice. I do a lot of minimally invasive surgeries. I have a lot of referrals from different doctors, including other OBGYNs, to do minimally invasive surgery and things like hysterectomy. And so there's some women, I think, that have been programmed to hear that this is such a horrible, life-changing thing that even the mention of the word really upsets them.
And they've even been told, shh, don't even tell people that you're having this, because you're not a woman if these parts are removed.
Yeah, I mean, I think that's really unfortunate. I mean, one of the things that I try to really emphasize is a hysterectomy. A total hysterectomy simply means the removal of the uterus and cervix. Almost everything that makes you a woman, your hormones, how you feel, your personality that comes from hormones, comes from your ovaries. And I think there's a huge misconception. Removing the uterus does not put you into menopause. Removing the ovaries do. And in 2016, there's very few reasons that we remove the ovaries anymore, because that doesn't really fix the problem. Removing the uterus is really what we need to do to fix most of these problems.
And a lot of people complain about having fibroids. They may notice them when they're in their early 20s, 30s. By the time, like me, they're in their 50s, they've grown to the size of grapefruits or oranges, and that's why you make the decision to pull up for me to have a hysterectomy.
Absolutely. I mean, just the presence of fibroids doesn't mean we need to do anything. But when they become symptomatic, painful, heavy bleeding, interfering, they can cause things like severe constipation, urinary issues, as they get bigger and bigger. So, there does come a time that conservative methods are going to fail, and you really do need to remove the uterus.
Because like you said, those fibroids start to affect other organs in your body.
Oh, absolutely. I mean, I've been doing this 22 years. I do a lot of surgery. I have many, many patients whose fibroids have gotten so big that it's obstructed other organs, like the ureter, that's cut off the urine supply coming from the kidney and cause women to lose their kidney, for example. So
am I going to come back to work crazy, and what kind of hormonal changes will I be experiencing after something like this? Because that's another issue too.
Well, and that's one of the things I counsel a lot. So the good news with you is that we're going to go in and we're going to do this laparoscopically with the robot, which means very small incisions, very quick recovery time. Also, we're going to remove your tubes, because now we know that 50% of ovarian cancer starts in the tubes, and that doesn't interfere with your hormones, but both of your ovaries are going to be left inside, which means, luckily, no hormonal issues, no problems. You won't be crazy at all.
They already think I'm crazy. Doctor, thank you so much for taking the time out. If people have more information, what's your web address or your Facebook page so they can have that conversation with you if they can't do it in the office with their own doctor?
Yeah, absolutely. Our website is whcillinois.com, and also you can find Dr. Kenneth Finkelstein, Women's Healthcare of Illinois, and on the internet, on the phone book, so feel free to call anytime.
You're like, just Google me, okay?
Just Google me.
Thank you so much. I'm in good hands. All right, 7:35 right now. Coming up, 20